Welcome to This is Oregon, a podcast where we take you inside research happening at the University of Oregon and show you how it applies to your everyday life. I'm Kira Wilson, your host for this episode. Our guest for this episode is Dr. Sunny Bay, Assistant Professor of Children's Behavioral Health and Psychology, whose research team is taking a look at children experiencing stressors and what that means for everyday parent-child interactions. Sunny, thank you so much for joining us. You describe yourself as a family scientist who's especially interested in day-to-day realities of family life. Can you tell us more about what that looks like in your research and why studying the everyday is so important?
Sure. So conceptually, what that means is that I study everyday interactions, like whether the youth thought that they had a fun day with their parent today or whether they felt critiqued or criticized by their teachers. These everyday interactions seem relatively unimportant, but together they contribute to our general impressions about relationships that matter a lot to us, like how close we feel to the family or whether we feel safe at school. I also study everyday stressors that are unavoidable, like getting a bad grade on a test or feeling like someone's talking behind your back. Again, these on their own don't feel super harmful, but they give us a really important opportunity to practice different ways of coping. And the way that respond to these stressors actually have implications for long-term mental health. I also use different types of approaches to really capture experiences as they're coming up and unfolding in everyday life. I conduct studies using ecological momentary assessments or brief surveys that participants can fill out sometimes several times a day over multiple days. And they help us get at questions like, right now, how do you feel? Did you feel upset in the past 2 hours? Or what happened at school today? And then finally, I use naturalistic observational approaches, or these are basically recordings, video recordings of everyday interactions that youth may be engaging in with family members or others. Sometimes it can be audio as well, or others also record interactions that one might be having online on their smartphones. But all of these approaches really help us capture behaviors as they're, again, coming up in daily life.
Thinking about ways that you observe behavior, such as recordings, what's a method that you've used for that?
Sure. I like to use what I call naturalistic observational methods or ecological behavioral methods. And so let me just tell you what that looks like in the most recent study that I did.
Yeah, great.
I really wanted to know how parents and kids are talking to each other after school, especially during or on days when kids might have had some rough things happen to them during the school day. And so I had parents and kids install small cameras on the dashboard of their cars, and I asked them to turn it on or plug it in whenever they were in the car together, like going to soccer practice, maybe picking up takeout, going on a Target run, moments like that.
Okay, so using dash cams in the car is a fascinating method. So why did you choose that approach, and what kinds of things are you learning from those recordings that you might not get through like a survey or an interview?
Yeah, I chose that approach because what we're actually doing in daily life can look different from what we think we're doing or what the other person thinks maybe a mom is doing or a dad is doing. So these behaviors or these observational methods that I use allow us to capture behaviors as they're really unfolding. And we can capture those behaviors and measure them without the person's subjective sort of interpretation of the behaviors that are happening around them. So one particular type of interaction that we've really honed in on is support communication. And when I say support communication or supportive communication, what I'm referring to are conversations that convey social support or conversations wherein the youth is seeking support. So we have recordings from 138 families And so far, we've done a deep dive into the first 3. We've also looked at like an additional 50, but the first deep dive with our first 3 families have shown that across a week or 2, based on the recordings that we've collected, there are a total of about 52 episodes of supportive communication between the parent and the teen, where the teen was asking for help or signaling a need for support. And most of the time, parents responded to that need or picked up on that need, although not always. We found, for example, in this data that a type of support that we call informational support was the most common. We can think of informational support as advice giving or seeking clarification questions to get more information. And that's the kind of support we're seeing coming up the most in the day-to-day lives of teens and their parents.
To back it up for our listeners, briefly, can you walk us through the types of supportive communication definitions and how they showed up in this particular part of your research?
Sure. So I was looking at 5 different types of support in my research. The first is emotional support, and that is where you make someone feel understood and cared for. The second type is informational support, which is providing advice or information. The third type is esteem support, where you are trying to build someone else's self-confidence or self-concept. The fourth is social presence, just being there, which all of these parents were. And then the last one is tangible support or instrumental support. And this is where you're really trying to do practical things to help someone, like take them to practice. We know that support of all types is really important for youth mental health, and teens who report that they are feeling supported and that they have people to turn to tend to have fewer symptoms of mental health problems or mental distress. But there's a lot of nuance to this that remains somewhat underexplored, and that's what I'm really trying to do. Not everyone wants support in the same way, and not every situation calls for the same kind of support. We know that's true from adults, but we're not quite sure how this looks for teens who are really figuring out their preferences and their styles.
Okay, so what you have found in your research is that the informational has so far been most common, and emotional is also something that the youth are seeking?
Yeah. So as I mentioned earlier, in the 3 families that we've done a deep dive on, we saw 52 episodes of supportive communication, and informational support showed up in almost every single episode that we identified. And then emotional support came up a little less than half the time. Some things we just couldn't measure, like social presence, we couldn't really measure because the parent and the teen were together all the time. And then tangible support was a little bit hard to measure using this approach because the parent and the teen were stuck in cars. But that was okay. We wanted to know what transpired in everyday conversations. And informational support actually make a lot of sense if you think about your own relationship with your caregivers or your youth. Informational support was considered to be present when the parent asked a lot of clarification questions to maybe convey their interests, get more information, get a better understanding of the child's situation, and or provided advice and opinions. And we found that parents were doing a lot of clarification seeking when the child was bringing up a negative event or a negative experience. And so that came up really almost all the time. And we found that, or in conversations with my colleagues in communication sciences, I actually found that that was not that surprising, although as a psychologist, I did find it somewhat surprising. He said that advice giving is the most common form of support, even among adults. And so I guess that's what we're all really compelled to do.
Wonderful. So pivoting slightly, what has data from surveys that are filled out shown so far?
Yeah, so we had the parents and youth complete surveys about how they want to be supported and what they're doing to support their teen at the onset of the study. And we've analyzed that data together with my students, Gary Barawaj and Serena Wu. And they found a few things. Specifically, we were interested in how these supportive communication preferences and perspectives were associated with youth mental health, and what youth wanted and what the parents felt like they were giving. So youth wanted esteem support the least, and also they reported receiving it the least. Parents, as I mentioned, reported providing esteem support the least, and they also reported that they provided informational support at relatively lower levels, which is interesting because in our observational data, we actually saw quite a bit of informational support. We saw overall that when youth received a lot of emotional support from their parents, they were doing quite well, as in they reported the lowest levels of depression. When youth sought out a lot of informational support from their parents, they were also doing quite well relative to other youth, again, meaning that they reported lower levels of depression. Interestingly, youth who wanted more esteem support than the average peer were showing greater levels of depression. We also found some interesting patterns between what the youth wanted and what the parents said that they were giving. So, for example, one really interesting finding we noticed was that regardless of how much they want, if there is a mismatch between the amount of informational support that the youth wants and the amount of informational support that the parent is giving, that was very associated with youth depression. And specifically, if the youth were receiving more than what they wanted, so if they were getting too much informational support, those kiddos were reporting higher levels of depression symptoms.
Oh, interesting.
And I think that's really interesting because I know this didn't probably, or I mentioned this really briefly in just a little bit ago, but in general, kids wanted informational support. So informational support on its own is not a bad thing. And in fact, we think that it can reflect problem solving and coping. The child wants to receive advice to figure out what to do when they're presented with a problem, and that's a good thing. But when the youth is wanting more than what they feel like they're needing, then that can we're seeing that being correlated with depression symptoms. And what we think might be going on there is that perhaps these youth are as I've already mentioned, maybe getting too much help.
Yes, it definitely sounds like there can be a mismatch between the support that kids are looking for and the support that the parents tend to offer them. Some interesting gaps and mismatches there. It seems like that can really make a difference.
Yeah, and actually we know from the couples literature or research on couples that looking at these matches or balance, I guess, of support seeking and support provision is really important. For example, in couples, there's this idea of invisible support, where support is most helpful and most effective when the receiver doesn't even know that they're getting that help. And I think what we're seeing with this informational support mismatch piece is perhaps that yes, it's helpful for youth, they want it, but if they feel like they're getting too much of it, it's going in the opposite direction of invisible support. It's very visible, and perhaps leading youth to feel like they don't have autonomy or they don't have a lot of power to make their own decisions. That's just one possible explanation.
Yeah, it sounds like that balance can be sometimes difficult to
Yeah, absolutely. And I don't want any parent to feel like providing advice or asking clarification questions is bad. It's actually very helpful, and most youth want some level of that. But also being attuned to what the youth is needing, and also being really cognizant of the youth's developing autonomy, I think is really important during this period.
Yeah, absolutely. Well, since it is back to school season, I would love to ask you a question about school stress and how that spills over into the home and What can parents do to better support their kids through those everyday stressors?
Sure, I'm happy to talk about that. In some of my previous work, I looked at stress spillover, and that was actually one of the reasons I wanted to look at supportive communication. Spillover is how stress in one area affects another. So, how stress at school can affect the home life, or how it spills over into the home within the same day or even the next day. In a prior study, I looked at whether parent-child conflict increased on days when youth experienced more stress at school. That is, did stress at school spill over into the home and create more stress? What we found was that following difficult days at school, the youth felt like they argued more with their parents, mothers and fathers, and they were less warm and fuzzy with their mothers and fathers. And this pattern was mediated by mood. What that means is when the youth had a rough day at school, they felt worse. And that worse sort of mood contributed to this feeling that they got into more arguments with this perception that they got into more arguments with their parents, mothers and fathers, and that it was less satisfying, the interactions at home. So I thought that kids who are coming from generally very close-knit families would be somewhat protected from this spillover effect. No matter what happens at school, they feel really good about the time that they're spending with their parents. But what I found was kids who are closer to their parents and coming from more tight-knit families, they were experiencing the greatest level of spillover. And that closeness really seemed to amplify the spillover effect. The other piece that was somewhat interesting was that parents actually didn't notice a change in their interaction quality. Parents were like, things are normal. And it was really the youth who was perceiving that they were getting into more arguments with their parents and that they were less close. So it could be that things are okay on the whole. And still, of course, youth perceptions matter.
Yeah. Yeah, it would seem to me that, parents, coming from a parent myself, of thinking like, oh, they just had a bad day.
Yeah. And I think that's a really reasonable response.
Yeah.
And actually, it could also mean that even though the youth feels like they were more, or the adolescent feels like they were more distant from their parent, maybe those negative feelings didn't manifest behaviorally.
Mm-hmm. That's so great. So what can parents do in these sorts of instances?
I think, so thinking about both research studies that I just had the opportunity to share, I think first we definitely want parents to be offering emotional support and to be present if possible, if their work schedules allow. And our survey data has shown that kids can never have too much emotional support. We also know from other work that emotional support, or providing comfort, showing understanding and care, is very potent and very helpful. I think it's also helpful for parents to be available if the child is seeking information or signaling a need to talk about their day more, or get advice, or get questions. Or get questions answered. Many kids do share about their day, although not everybody does. And if the child is seeking the parent's perspective, it's a really great moment to reinforce problem solving and helpful advice seeking. Those are really good coping skills, very proactive. At the same time, we want to resist the urge to interrogate and sort of be the interviewer. I know parents want to ask a lot of questions, but we have to maybe do that kind of question asking, or asking for details sort of at the level that the child is seeking. The kid also, or the youth will have bad days. And I think as humans, we all know that there are bad days and there are good days. So just remembering to balance the bad days with fun days, or lighter sort of relaxing days, I think is important. And my research at least seems to suggest that when you are close with your child, you may get the full range of emotions, both the irritability and the joy. And that's not the worst thing.
Yeah. Both the irritability and the joy. I love that. So, Sunny, as you've been working on this research, what has come as a surprise to you? Has any of your findings challenged your assumptions?
Yeah. One thing that we hear from colleagues is like how authentic are families really when they are when they know that they're being video recorded or observed on video or observed either through direct recording or their phone. One thing that really surprises me, aside from all the interesting findings that I had the opportunity to chat about today, is that people surprisingly are showing their authentic selves. And maybe it's not the most authentic. We would never know, right? Because we don't get to be true flies on the wall, but we are seeing a good range of behaviors, interaction types. Every family is different, and there are just so many different ways that parents are connecting with their kids and caring for their kids. And it's just really inspiring and fun, and it gives me really good ideas. And so, yeah, I think that's like the one thing that I've been the most surprised by. There is so much diversity, so much individuality, and at the same time, just care.
That's great. Fascinating stuff. Well, Dr. Sunny Bay, thank you so much for your time and sharing your research with us today. Any final thoughts you'd like to share with us?
No, thank you so much for having me.
Thanks again for joining us today. If you're interested in learning more, check out the links in the episode description, and don't forget to follow This is Oregon for more stories from the University of Oregon. We'll see you on the next episode. This is Oregon is produced by the Division of University Communications. For more of the latest University of Oregon research and news, visit news.uoregon.edu or find us on your favorite social media platform using the handle @uoregon. Thanks for listening, and go Ducks!